Hello, I'm Dr. Helen PENSANTI, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're diving into one of the most pressing health issues of our time: diabetes mellitus. It's more than just a sugar problem, it's a global health crisis that affects the heart, kidneys, nerves, and even our economy. Joining us today is the compassionate and brilliant, I would say, Dr. Bryn Henderson, a physician deeply involved in both conventional and regenerative approaches to care. Together, we're going to unpack what diabetes really is, what causes it, and the promising new treatments emerging on the horizon. Dr. Bryn Henderson is not just a physician, he's a visionary with years of experience in internal medicine, medicine, regenerative therapies. Dr. Henderson has been at the forefront of developing new ways to treat chronic illnesses, including diabetes. His unique approaches in his office combines the best of modern science, patient-centered care, and emerging regenerative techniques. Let's start with what exactly is diabetes mellitus, Dr. Henderson.
Well, thank you. Diabetes is a condition where the body has trouble managing blood sugar levels. Normally, a hormone called insulin helps sugar move from the blood into your cells. Insulin is like a truck. It helps the sugar move from the blood into your cells for energy. When we eat, the stomach breaks down food into glucose, which enters the bloodstream. Normally, the pancreas produces insulin to help this glucose enter the body's cells. In people with diabetes, especially type 2, the cells become resistant or the insulin isn't used effectively. And this causes the glucose to build up in the blood. The diabetes, either the body doesn't make enough or it can't use the insulin properly. This leads to high blood sugar, which over time can damage many organs, including your heart, kidneys, eyes, and nerves.
All right, well, let's talk about the different types of diabetes that people should know about.
Well, there's three main types. Type 1 is usually diagnosed in younger people and happens when the immune system mistakenly destroys the insulin producing cells in the pancreas. Type 2, which is far more common, typically develops in adults and is linked to lifestyle, genetics, and age. There's also gestational diabetes associated with pregnancy.
Okay, so why is diabetes becoming so common today? I will tell you, if I have scheduled 20 patients for a day, I would say 6 of them have diabetes, at least.
It's a great question because it's a mix of lifestyle and environment and genetics. It's all three. Our diets are high in sugar, unhealthy in fats. Many people don't get enough activity and surely don't drink enough water. But it's not just behavior. Genetics, stress, look at stress. It alone can increase your sugar. Sleep problems, pollution, and even conditions during pregnancy can raise the risk. Urbanization and poor access to healthcare also play major roles, especially in developing countries.
All right, so what are the early warning signs that people should watch out for? What if, for example, a patient is proactive, they go in, they have an annual female checkup or an annual male checkup, they do their blood work, their sugar is in the normal range, their A1C is in the normal range, they're nowhere close to diabetes 2. What could be a red flag that you're on your way to prediabetes?
Red flags include feeling very thirsty, urinating a lot, or being tired all the time, or any sudden weight loss or blurry vision. But some people, especially those with type 2, may not even notice these symptoms. That's why the routine testing is so important.
All right, speaking of testing, what kind of test?
It's usually a blood test because we want to know how much sugar is in the blood. And that's usually done in what they call fasting blood sugar. There's another test that's a 3-month average, and that is called a hemoglobin A1C. It's more accurate and correlates better with complications. So it's often preferred over the long term. But if that's 6.5 or higher, it confirms the diagnosis. There's also blood glucose testing and random sugar testing. The blood glucose testing is very common in pregnancy, and that is important for delivery.
It seems so strange that just a high sugar level could cause so much damage. We've mentioned that it could be the kidneys, the eyes, but what exactly causes the damage?
It's the excess sugar that damages, and it doesn't just damage the vessels, it gets into the small parts of the vessels or the nerves, not just the big nerves, it goes into the teeny weeny parts of the nerves. And the tissues absolutely can malform, cause changes in the formation of different tissues because it increases inflammation. The stress inside the body is different than the stress outside the body. The stress inside the body changes the balance of hormones and proteins and energy in those cells. And so over time, it can lead to many very, very dangerous things. Kidney failure, nerve pain, and even amputations. That's why early treatment and long-term control are so critical.
All right. So what is standard of care treatment for diabetes today?
That's an excellent question. It begins with lifestyle changes, healthy eating, healthy sleeping, healthy exercise. And then we use medications. There's many types. There's metformin, and the newer drugs are actually replacing metformin, the GLP-1 receptor agonists.
Let's talk about metformin because so many of my patients say, I'm going to put you on metformin. They go, oh no, doc, somebody else did that and I had diarrhea and I was crying. I hate it. I don't like it. My muscles feel weak. The side effects are so horrible. Put me on something else. I beg you. Do you have that problem?
Yes, absolutely. And that's why I think there's such a wide open opportunity for the newer drugs that include weight loss and better control of fluids, more water.
So the new weight loss medicine are called GLP-1, like Ozempic, Mounjaro, tirzepatide, Wegovy, all of those. They not only help you lose weight, but they also help control the blood sugar. Isn't that amazing?
Yeah, it's good.
So what about traditional Chinese medicine for diabetes?
As we've stated before, it's been around a few thousand years, and they have very good control if they stay in what they call internal balance. These practitioners focus on energy, organ energy, circulation. Herbs like ginseng and cinnamon are used to support insulin function. Acupuncture helps with sugar regulation, and stress reduction is a double whammy of improvement. It's a holistic approach that complements modern care.
All right, let's talk about some of the latest and greatest regenerative medicine and the cutting edge treatments that you're doing.
There's no question that for diabetes, this is really exciting because we can use stem cells to grow new insulin producing beta cells in the pancreas. That's being done in other countries, and it's effective. And it's being used in some very brittle diabetics today or young, dangerous diabetes patients in pediatrics. There's also exosomes, which are the little healing molecules called vesicles that do a fantastic job. And let's not forget the peptides that mimic hormones and restore the metabolic balance. Those are very good.
So you talk about genetics a lot in some of our other discussions. What about diabetics that start even before birth?
No question about it. In fact, you can take our family. We had a son that was 10 and a half pounds. So his mother was a gestational diabetic. And anything over 8.5 pounds should be looked at very closely as far as the health of the mother. Now, it can affect other organs too. I mean, besides just the pancreas, it definitely has long-term consequences on the brain, and we think it has long-term changes in terms of metabolism, even much later in life. That shows that the prevention truly begins in the womb.
I've noticed that when people lose weight, their diabetes too disappears. Does it happen with everybody? No, but you can see that, say they lose 50 pounds, and you do the A1C and you do the fasting blood sugar, they're in the normal range.
No question. But you got to make sure that it has some long-term education in this thing.
Okay, so if I bring a patient back to normal and I've got them in a normal fasting blood glucose and I've got A1C of 5.6,
Okay.
do I have to still put them on metformin?
No, in fact, they're pre-diabetic by definition under 5.7. So you just by the hair on your chin,
Yeah.
nipped it down. But either way, what they want to do is they want to monitor their output. If their urine's always clear, they're good.
Okay.
If they're, however, everybody cheats sometimes, right?
Yeah.
So if they cheat once in a while, the very first thing to do is to get back into balance, fluids.
All right. So we talked about that diabetes can be reversed and if it's caught early. So you're saying 10% of weight loss will help? Is that the number you like?
That's where it began for sure.
Uh-huh.
And you'll have a major impact on their long-term health. So now I've lost 10%. What do I do? Well, you start exercising, but you better have good sleep or it's not going to hold.
Okay. So any final thoughts for our diabetic patients or someone who has a loved one that has diabetes and they want to make sure that they live long, healthy lives? What do you want to say?
I would agree it's serious, but it's manageable. And with the right approach, these people can live long, healthy lives. And I encourage them all to remember diabetes requires a plan to stay on track.
All right, well, let's do our mnemonic for diabetes. The D stands for
Diet matters.
I.
Inject and take your medications.
A.
And that's activity, everyday, regular exercise.
B.
B is the blood sugar check.
E.
E is eye, foot, and kidney care.
T.
Is take control of the stress. Stress is a killer.
E.
E has to do with educate yourself and your family.
S.
X is stay connected to your care team.
I would like to say that we send our diabetic patients to an eye doctor once a year to have their retina looked at.
You bet.
What are they looking at in that retina?
Blood vessels. It's the only place in the body you can see the blood vessel, right? So you can see if there's nicking. You can tell how good a control they've had. It's probably one of the best corollaries with A1C.
Excellent. Well, thank you very much for being with us today. We hope you have been encouraged to be proactive about your diabetes, or if you have a loved one, encouraging them. Thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.